Very good evening, my beloved colleagues. For today, we already declared before that today will be our inaugural session of upcoming OSCE course. Hopefully, you are in good health and very ready to be the part of today's discussion. It is as inaugural or introductory today. We will give you some highlights and the plan program what we are going to do in the course. So this is very important, and with my humble introduction from the institute and the moral alert as before, we will give you some description of the course, how it will go onward. Plus second part is the practice session, not as actually the original session or class one for the course. It will be different, but today we will describe how the course will run, how we will do the case practice. And as you can remember, last few days back, we discussed the new strategy of the OSCE preparation. And already we have given the record to you. And today we posted two pictures for you. What we like to discuss today, not too much discussion, already you have heard it, to follow rather that the structure or information sheet we will follow. I believe that minimum some of you have seen this picture today, and you are free enough today as well to be taking part in the discussion, not only listening. So hopefully we can start now. First of all, I like to show in this slide, in short, the course is going to be a total 50 cases of ski practice course. Our plan to enroll only 5 active candidates. It means that each candidate will get directly 10 cases to practice. Usually, we distribute the 10 cases in 10 classes. One case per candidate every day. So 5 cases for 5 candidate every day. Every day means every class, every session. And but other candidate will be active listener. In the meantime, the word meaning active listening in the OSCE. So I hope all of you know it. If you don't know, you can ask me also. When one candidate is performing, other candidates will be listening. Later on, the other candidate also will take part in the discussion in the feedback time. Okay. So first we will select the category of the cases. I will show you a little later. But in these 50 cases, you will get the different categories of the cases. All the types of cases usually found in the OSCE carousel, 14 stations carousel, and different strategies Royal College are adopting. You know that the patients are not a real patient. Mostly they are surrogate. Nowadays, they are trying to produce or present some real, not exactly real patient. It is called the standardized patient. Some findings you could see there. For example, I can remember also the patient was having senile arcus senilis. I forgot that he might have the xanthelasma or not. So some similar findings you may get, but mostly the exam is of surrogation. In the surrogation, sometime the Royal College utilizes some clinical pictures to present the clinical findings, including ECG X-rays are there as well. According to the case, you will face some ECG X-rays, and there are some investigation reports as well. So this is the 50 cases, and our plan is to guide you from the beginning. Already the colleagues, those who actually registered, you got the checklist updated. And the checklist, for example, today we will show how to use the checklist. Checklist means definitely before the exam or before the class, you will go through the checklist of the related topics. Exact diagnosis or other thing may not match with the case presentation, but topics will be relevant or related. So after gathering the knowledge earlier, it will be easier for you to take part in the class as active participant and as well as in the discussion participant. So only 5 Ks as we will practice, it will not be very big job for you to go through the 5 cases. And usually our the classes are 2 in a week. One is the Sunday evening, another is the Friday morning. Already we discussed with you also, those who registered before. So it is very easy to go through the checklist earlier. And we will try our best to keep the class record for the registered doctors. And I believe that after a successful discussion, the listening the audio again might be wastage of time for some candidates. Even then, if any candidate wants to listen again, we will try to provide to the registered participant to listen until the coming OSCE exam, that is the Chennai exam. So these are the main component of our OSCE case practice now. I hope all of you understood about it. And then I'm proceeding now. Anytime you can take part in the discussion. So how session runs, I will show you and demonstrate. And I believe that you will take part in this as a candidate also. We will invite you in the meantime. If we select a case of non-specific diagnostic clue with a patient, non-specific means a febrile patient. I have just selected for you one case today. And who want to practice with me now, please? Doctor? Dr. Abu Wahab or Abu Omar, are you here?
Yes, I am here, but
Are you
at
free?
time of prayers now.
Prayer. Oh, so we will
Let
invite
me
you
select this
later.
one more
You get,
session.
yes, yes, you take your time. Any other colleague? Dr. Walid? Dr. Walid, what about your timing? Sorry, anybody, please, any colleague should respond to save the time. Any other colleague? Don't worry, your performance may not be good enough. Just we will make a rehearsal today for the coming course. Actually, it is not exactly class one. This is the open session for everyone. Any colleague wants to be with us as a candidate? Why not? Dr. Zaidi, please. Dr. Saini, possibly. Zaidi Saini.
Okay,
Are you free or getting time to talk with us?
okay, I
Fantastic,
can.
fantastic.
Yeah.
Any other colleague can take part. So we will give you 10 minutes time. Okay. But before I will try my best to introduce the case. Don't worry. But
Okay,
like the exam, try to perform 10 total 10 minutes time. What I will do, I will be observer and other, I hope that other colleagues also will be observer. And you understood this headline. We will give you a patient of the fever and checklist, whatever you have in your mind, don't worry. You are seeing the patient of fever every day, right? In your chamber, in your practice, almost
yes.
acute febrile
Mm.
illness or chronic febrile illness. Mostly acute febrile illness are there. So checklist in your mind that you may get a case of fever in the OSCE. In such a way, this is the instruction. Dr. Zaidi, can you read this case, please? For this is exactly what be given in the exam in general. But fever 8 day will not be given. It is only for your clarification or additional information given. Read other thing, please. From here, Mrs.
Okay.
Khanam. Mrs. Khanam, she is 30 years and Mrs. Sahili Khanam is aged 30, and then please carry on.
Okay. Mrs. Sally Khanum, aged 30 years. Mrs. Khanum is waiting to consult me with fever for
Pulse,
8 days,
pulse.
with pulse of 60 beats per minute and blood pressure of 125/80, with temperature of 39 degrees Celsius. Please
Okay,
consult, perform relevant clinical examination, and make a management plan.
right. So you understood when you actually, if you have gone through the checklist earlier, then
Mhm.
you can make a mind map that how I will ask, what I will ask. That means what data I will gather, what clinical examination I will do, and finally, after the probable diagnosis, I will make a management plan, including investigation. I think you know, right?
Okay.
The
Mhm.
investigation is a part of the management plan. So for further clarification, I'm showing you this one. Okay. And
Okay.
I want to go back a little for a few seconds, just for a little extended information. This is female patient, 30 years. This is also important clinical clue, right?
Mhm.
And
Yes.
pulse, blood pressure, temperature, also important clinical clue. You
Mm.
don't know the fever of 8 days. More likely, I will tell
Okay.
you to make the session today simpler. Possibly new colleagues also maybe will be with us today. For this reason, I have shown you. So we should
Okay.
have a summary, right? Better not to tell now. There, we can actually create some differentials of such presentation of a febrile patient. There might be female organ related disease, or in general endemic disease, or other whatever. In this way, as the checklist in my mind now, rather to say customized checklist, right, Dr. Zaidi? Customized
Yes.
checklist means until I have done customization with the previous slide, that is the instruction given in the door of the OSCE station. Now, that is the thing, what we discussed before. Just have a look only. I will not discuss now because already you have seen or heard before. So our job
Mm.
is to identify this thing. Diagnosis and the social history is very important for each and every patient. For this reason, we put it up. And in general, from the history of presenting complaint, you will get the diagnosis in general. But additional
Mm.
read informations are actually read in the exam. Then go for the focused examination to consolidate the clinical diagnosis or probable diagnosis or differential. And by the clinical examination, we can exclude some differential diagnosis as well. So in the diagnosis, as a family physician, we need to consider the psychological status and the social status of the patient. Considering this thing, you will make a very good management plan. That means that if any psychological issue, you have to manage it. If any social issue, you have to settle or manage it, or by giving the suggestions. So our job is to solve the problem, and how to sort
Mhm.
out the problem list, diagnosis, differential as well, etiology of the disease, complication of the disease, comorbidity of the disease. Sometimes the complication may not be clear, sometimes etiology may not be clear. But in general, any disease should have etiology. It is infectious disease or inflammatory disease or neoplastic disease, whatever. So this diagnosis or clinical disease related, rather, I like to say one sentence here. In addition, red flags, eyes, lifestyle, impact in life, hidden agenda, ethical issue, legal issues, many other issues. If there, we have to write in a paper. Dr. Zaidi, do you have a pen and paper with you?
I do, yes.
Please, it should be in our courses also in the class time. Every doctor better should write. Minimum problem list should be written, otherwise you might forget. And you can do in the exam hall, in the orchestration.
Mm.
Then come to the management. Explain diagnosis after summary. Summary findings, that means history and the examination, then tell the summary. Okay.
Okay.
Uh, investigation plan after telling the summary diagnosis also that you will do some investigation. And I like to say you that highlight the point of care test which is available in your hand right now if possible. For example, Dr. Zaidi, possibly I don't know did you attend the previous session or not. For example, dipstick urine test, dip the urine. It is a point of care test. Blood sugar could be a point of care test. If any relevant point of care test, better to do. Other thing will send to the lab. Then solve these one by one. Red flag, idea, concern, any lifestyle issue. In general, in the family medicine exam, they should have one or two lifestyle issues. It's better to identify it. What about the clinical stations? Then consider the medication of the specific disease or what I say, probable diagnosis. There should be pharmacologic, non-pharmacologic treatment, and any medication, try to give the management plan. Sorry, adverse effect management plan. For example, any NSAID, definitely I will tell about the peptic ulcer issues or dyspepsia, what patient is to do. We can give PPI. Even then, patient can take antacid syrup. If red flag is there, you will tell the safety netting issue. Okay. Anyway, the OPD follow-up, referral, and hospitalization, the final treatment place, location of the treatment. Usually, in general, most of the case, you are the doctor to deal the patient as OPD follow-up. But referral may be needed in second visit. Referral may be needed in the first visit, rarely in your upcoming exam. But keep in the mind, if any acute emergency, most of the cases most likely to be hospitalized. But you have to do something. Primary treatment, you must give. You have to tell to the patient. Safety netting, already I told you, any emergency situation could arise and what patient is to do. Finally, opportunistic health promotion, especially big major health hazardous behavior. For example, the cigarette smoking, alcoholism, more body weight. Like in South Asians, there are some other habits which are not actually mentioned in the book. My native South Asian colleagues can comment. This is the bitter leaf. I think some colleague can share with us. Bitter leaf with the tobacco leaf added. It is almost similar to the smoking tobacco. Another is the extra dietary salt. Very important in my experience also. So these are not written much in the book. We could add also if I can identify, especially in cardiovascular risk analysis. Okay. Then Dr. Zaidi, mic is off. Then this is the observer sheet or examiner sheet. So everybody have a look, please. And if you I'm going back. I'm sorry to say, if any colleague couldn't make the copy of the post given before, you can make a snapshot for today's this session, this one, and then this one. Because if you want to get the benefit, you need to consider these points from the today's presentation. Otherwise, only listening, you have listened a lot, you gathered a lot of knowledge. There will be no value. And we will try to give you marking accordingly, according to the OSCE exam. Clear, Dr. Zaidi?
Okay.
Usually we will mark you for the 4 points. These are overall assessment, it is not needed, especially the 4 domain of the mark sheet or skill rather to say. So examiner will give you marks for the skill, not for name of the medication, not for the name of the diagnosis in general. But the diagnosis should be there, your medication should be there, but marking will be given in this way. So remember that whatever the time you are managing, you need to touch these 4 areas of skills. Otherwise, you may get 0 in the number 4. If you are very fantastic up to 3, so you are not getting maximum marks. Clear?
Yes.
Very good. Very good. So there will be 4 and other maybe 1, 2, 3, 4 like that. This is the observer's issue. I request other colleagues, if you want to give the marks, consider these 1, 2, 3, 4 for each skill. Later on, we'll come back. Don't worry. So now, Dr. Zaidi, can we start the practice now?
I'm
Are you
just
ready?
going to have a read first.
Little rest. Why? Already I explained the thing.
Oh, no, I'm just going to
Can
have
you
a read
go
first.
to the fresh
Dr. Abu
checklist
Amar.
replacement?
Dr.
First
Abu Amar.
checklist.
Dr. Abu Amar. Dr. Zaidi will perform now. Okay.
Can you go back for a slide of the
This one,
checklist? The first one.
first slide.
Yes.
Didn't you get it, doctor, in the group? Okay. Copy quickly. Quickly copy it, please.
Thank you.
And the next one, this one. This is actually mark sheet in the hand of the examiner, but we must have in our mind, right? Especially the 4 headlines. These were not needed. Consultation is skill you don't need to keep in your mind. It is your inherent quality. But data gathering should be problem in question. Okay, not random data gathering. This is the main head words or keywords. Okay, examination or counseling be specific like this, like this. A lot of discussion happened before about the basic thing. In the basic module also, you will get it. Let's see now. Don't worry. As our plan to perform case 2, case minimum today, everything will be okay. So, Dr. Zaidi, I am counting your time. So, I will be your patient today. Okay.
Okay.
So, have a good look to your patient, Mrs. Khanum, is it?
Mrs. Khanum, age 30
Yes,
years.
okay, already understood. So what I like to do here in our online session also, just as a rehearsal today,
Yep.
I will tell you enter please, then you start to talk. Okay?
Okay. Is that when the time is started?
I will count the time for you, don't worry. When
Okay.
I tell the enter please, then time started. You continue
Mm-hmm.
talk, data gathering. In the part of the
Okay.
clinical examination, you
Mm-hmm.
will tell that, can I examine you? Okay, okay.
Okay.
No, okay, doctor. Then you will tell name of the examination, what you like to do. This should
Mm-hmm.
be focused examination, no doubt.
Yep.
According to the history, right? History will guide the examination.
Mm-hmm.
Okay, after the examination, you will make or you will formulate the clinical diagnosis, probable diagnosis, including the differentials.
Mm-hmm.
Then you will tell the patient, okay, uh, before telling the diagnosis, better to summarize a little. Then investigation plan and other things are part of the management. Okay.
Okay.
Usually examination findings sometime told by the examiner or the surrogate. Clinical
Mm-hmm.
examination finding. Suppose you don't know which area you will examine after hearing or after taking the
Mm-hmm.
history, you will understand which area you will examine. Maybe abdomen, maybe cardiovascular, maybe respirology. In the respirology, surrogate, for example, in our classes, surrogate will try to tell you the finding if any important findings are there. Okay. Otherwise, you will tell
Mm-hmm.
that I will check the sign, name of the sign.
Mm-hmm.
For example, clubbing, one of the sign. For example, anemia. So a postgraduate should know that where anemia to be seen. No need to say that I want to check the lower conjunctiva to see the anemia, right? No need.
Mm-hmm.
You will tell that I am
Okay.
checking the anemia here, 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 or at best, minimum up to say that I can see the eye, I can see this one for this, for this. Okay, no problem.
Okay.
Better. But in exam, in the latest information, I like to inform you that if you don't tell what you are looking for, it is also not a big mistake in general, because examiner used to understand that you are looking for this. But if any critical
Mm-hmm.
sign, what is not be very clear when you are looking at the hand or somewhere, you can utter this
Mm-hmm.
word, if any special sign, which is usually not seen. Sometimes we don't see, right, as a routine, sometimes, but it is
Yes.
relevant for the patient. Okay. For example,
Okay.
I'm telling you half and half nail, where it is found, half and half nail. Any colleague, please? Half and half nail, Dr. Litton.
CKD patient.
CKD patient. Thank you. But usually in our general examination, we tell that koilonychia, leukonychia, like this, or at best, brittle nails. Sometimes Mees line, Boo's line. This is extraordinary findings. If you want to correlate the finding with your symptom or the patient's history, better you can alter this. Not in general everything. Sorry, doctor. Sorry. Take care of your noise. Okay, Dr. Zaidi, can you start now?
Okay.
Thank you, Dr. Zaidi. Again, I remember you were having very late night a little for you join with us. Don't worry,
No worries.
don't worry. And enter, please. Enter, please.
Okay. Good evening, Mrs. Khanam.
Good
I
evening,
am Dr.
doctor.
My name is Dr. Saini. I'm your general practitioner for today. I will be talking to you. Is that okay?
Okay, doctor. Okay.
Yes. I understand that you have some problem. How can I help you today?
Yeah, doctor. Definitely. I am waiting for you, doctor. Actually, doctor, I'm having fever, doctor. Last few days, near about already 1 week over, doctor. So
Okay.
I'm not getting relief from fever, doctor. I need your help, please.
Okay. So I'm sorry to hear that. Is there anything else? Are you having any other problem?
Yeah, doctor. I'm having headache, body ache as well. I cannot eat well, also, doctor. And I have the
Okay.
throw up as well, doctor, yesterday.
Okay. Um, is there anything else you want to tell me other than these?
What else, doctor, you like to know?
Okay. So you told me that you have some headache.
Yeah.
Can you tell me more about the headache?
Yeah, doctor, at the beginning from when I got the fever at the time is much headache, doctor. I cannot move my
Mhm,
head. When I move,
mhm.
then I feel pain and whole head actually I'm having the pain with.
Okay. Um, when did you start to have the headache?
From beginning, doctor, with the fever.
From okay.
I like to say
Uh,
you near about 8 days over, doctor, now.
the same time, yeah? Okay. Um, with the headache, how bad is the headache? If 0 is having no pain and 10 is being really, really bad pain, how would you score your headache?
It is near about 6, doctor, 5 or 6.
6. Okay. Um, and then do you have, and you said you vomited? How many
Yeah,
times did you
doctor, yeah,
vomit?
I told you yesterday, doctor, I have vomited, I have thrown up.
Is that the only time that you vomit?
Sorry, doctor.
So how many times did you vomit yesterday?
Yesterday, 2 times, doctor, one in the morning
Two
and
times.
another at the evening time.
I see. Okay. Um, do you uh okay. So you told me that you couldn't move, you have pain when you move your head. Uh, do you have pain when you bend forward, bend your neck?
Sometime, doctor, not always.
Sometimes. Okay.
But I don't
And
have
what
any
about
other
is the
problem in the head, doctor, only pain, nothing else,
mhm.
doctor.
So is it all over the head?
All over the head, I told you, I have whole body
Mhm.
pain also.
I see. Okay, sure. Um, so do you have any issue with your vision?
No, doctor.
Okay, no. Okay.
But my main
Do you
problem is
have
the fever, doctor. Really, I feel
mm,
much more bad, doctor, with the fever.
I see. Okay. Have you taken anything for the fever?
Uh, Sorry, check means,
Have
doctor?
you have you taken any medication
I took
for the
paracetamol,
fever?
doctor. I took
You took
paracetamol.
paracetamol.
Yeah,
Okay. Did the paracetamol help with the fever?
a little, doctor.
A little. Okay. How about the headache? Did the
Yeah,
paracetamol help
headache
with the
also
headache
become
as well?
less and a little, but again I got fever and headache again, doctor.
I see. So you still have fever with the
Yeah,
and headache
yeah,
with the
doctor.
paracetamol. Okay, sure. Um, um, may I know what do you do?
Yeah, doctor, I'm housewife.
Hello?
Housewife.
You're a housewife. Okay. And so Uh, okay. So when um, when is your last period?
7 days before, doctor.
7 days before. Okay, sure. So so you don't have any pain anywhere.
I have
How's
pain
your
also.
walking?
Yeah, doctor, I'm pain, especially
Mm.
I find in my tummy, doctor. In the
In your
right
tummy
side,
as well.
yeah, in the right side, lower part of the tummy.
I see. Okay, sure. So on the right side of the tummy. Okay. How
Yeah.
long have you been having that pain
Last
in the
last
tummy?
last 2-3 days, doctor, not before.
2, 3 days. Okay. How is the pain in the tummy?
Not too much, doctor. As
Not
you
too
said,
much.
as
Okay.
before, it maybe 3 or 4, not much.
Okay. Okay. So do you have any pain when you pass your urine?
No, doctor.
No. Okay. How is your bowel movement?
Bowel movement, doctor. From yesterday, I couldn't clear my bowel, doctor,
I
which
see.
is my
Okay.
regular habit every day to clear. But from yesterday, still not.
Oh, so you haven't opened your bowel?
No, today, not today, and yesterday.
Not today and yesterday, but you usually open your bowels every day, you said?
Yeah, every day, right?
Okay. So you haven't opened your bowel for 2 to 3 days.
Yeah.
Okay, sure. Okay. Um, do you have any allergy?
Allergy, no, doctor.
Okay. Um, okay. Is it okay if I examine you?
Okay, doctor, no problem.
Okay, sure.
So what you like to
Um,
do, please mention, please.
so I would like to check so I know the blood pressure
Already
and
given blood
the
pressure,
pulse,
pulse, and the temperature,
and
and
the
then
pulse rate.
proceed with
Okay.
further.
So I would like to have a look at the general condition of the patient.
Patient
So I would
looking
like
toxic, rather weak
to get
feeling.
talks.
Yeah.
Okay. I would like to know the hydration status as well. So looking at the if there's any dryness of the tongue, of the oral mucosa,
Yeah, tongue little dry.
little dry. Okay, sure. And then I would like to check while I'm looking at the head, I would like to uh, check if the patient is walking with normal gait,
Patient can walk with the
any
normal gait, but with weakness only.
with weakness only. Okay, sure. I would like to check for neck stiffness as well.
Sorry?
Any neck stiffness?
No neck stiffness.
No neck stiffness. Okay, sure. And then so I would like to check to do an abdominal examination
Okay. And you
because
found
patients
there
can
is a
be
tenderness in the right lower quadrant.
okay.
Otherwise,
So
okay.
okay. And then is there any rough
No,
sign?
no, no.
No,
Only just
no
tenderness,
rough.
nothing else.
I see. I would like to check the bowel sound as well.
Normal.
Normal. Okay. And then I would like to do
2 minutes left.
um,
2 minutes
okay.
left.
Okay. So I would like to do a quick examination, a POC. I would like to do a urine dip test since
No,
patient is complaining
normal,
about lower.
normal,
Okay,
normal.
that's normal. Okay. So, Mrs. Khanam, um, I understand that you have a fever for about 1 week, with headache as well, and you've been with body aches and vomited 2 times yesterday, and you haven't opened your bowel for 3 days. So, I would like, I think you are having, is that correct?
What, doctor? What I'm having?
Yeah, I just want to summarize that you are having a fever for 1 week,
Oh, that's all,
with
doctor. What you
headache.
said, this is okay. This is okay.
Yeah. So, with this, when I examined your tummy, it was normal as well. So, you, I think you are having some sort of virus infection
Which
at the
virus,
moment.
doctor?
Uh, it can be any virus, but
Okay.
usually it's a viral infection. So
Okay.
it's causing this headache.
Okay.
Um,
Okay, doctor.
yeah. So I think what you can do is um, I'm s- I would like to, uh, but you have a high grade temperature there.
Yeah.
But um, you but since you are not feeling that well, I would like to do, and uh, I would like to, but since you are not looking too well, I think, is it okay if I do some blood tests for you
No
just to
problem,
rule out if
doctor.
there's any sinister disease?
Okay.
Okay. But at the moment,
Time up.
I can see.
Time up.
Okay.
Dr. Zaidi, you can proceed further. Don't worry. Don't worry. You have done not bad. Don't worry. You proceed further, whatever, but be short, quickly.
Okay. Um, so, so I think you might have a virus infection, but because of the high temperature, I would like to do further investigation, blood test for you. But
Okay.
for the time being, I would like to give you some ibuprofen to make you feel better, and I would suggest that you can do to to take stool softening medication as well, if that's
Okay.
okay with you.
Okay, doctor. Okay.
Okay, so I will arrange for a blood test for you. This blood test is to check for your anything uh, want to make sure that it's not a bacterial infection because a bacterial infection can be more dangerous. So
Okay.
we'll do the blood test today if that's
Okay.
okay with you.
Okay.
Okay, so I'll do a blood test for you. We'll do the blood test today. But for the time being,
What blood test,
if
doctor? Can you tell me the name, please?
okay, I'm doing a full blood count, and this a blood test called full blood count, and then we'll do a blood test um, to check for a liver. I will do um, a liver function test as well, and
Okay.
then to check if there's any infection in the liver, because although your pain is on the lower side and liver is on the upper side, I would like to make sure that nothing is wrong with your liver. And then I would also want to check your kidney function as well,
Okay.
and I would check a blood test called CRP as well to check if there's any
Okay.
inflammation, which
Okay.
is usually raised when you have a bacterial infection, if that's okay with you.
Okay.
Okay, so we'll do the blood test today, if that's okay with you. And then I will review the results once it's done. But otherwise, you may go home with you can continue taking the paracetamol,
Okay.
the ibuprofen,
Okay.
and the stool softener. But with the ibuprofen, you have to be careful. You have to take it with food because it can cause gastric.
Okay.
Have you had gastric before?
No, doctor.
No. Okay. So if anything happens, if you have a gastric or gastritis, you may take some antacid with it. Yeah. Or
Okay.
otherwise, you can come earlier if you're not
Okay.
if if the pain still persists and if you still have fever. We may need to refer you early to the emergency if that's okay with you.
Okay, doctor.
Okay. Is there anything else you want to ask?
Yeah, doctor. Doctor, you told that this is a virus. I heard that the usually virus disease will not persist more than 1 week. But today, doctor,
Mhm.
around 8 days I am suffering from. Which extraordinary virus could it be, doctor?
Hmm. Some viruses can persist for 1 week, and it can take longer. But I
Okay.
cannot really say what virus it is now.
Okay.
So at the moment, at the moment, I would like to do some blood tests to check to make sure that nothing is um, going bad with your organs and for example the kidney and the liver. So
Okay.
unfortunately I cannot say what
Okay,
virus it
doctor.
is.
Okay, no worry, no
Yeah.
worry, doctor. So I will see you, doctor, after getting the report. And just
Mhm.
to assure me, doctor, is there any happening, any dangerous thing, doctor, with me today?
Um, at the moment, there is some fever going on, and you are not getting better after 1 week. So um, I would like to I would like to check if there is anything sinister with you. So that's why I'm doing the blood test.
Okay, doctor. Okay. Thank you very much,
Mhm.
doctor. Thank you. Time up.
Okay,
Dr. Zaidi,
okay.
thank you for
Uh,
your interactive participation now. And I like to introduce Dr. Zaidi, a little different for us, as Dr. Zaidi is from Brunei. Most of colleagues may be
okay,
from South Asians and the Middle East country here today, but Dr. Zaidi is from Brunei. It's a very late night, I know. And we are very happy that you participated. And we like to hear
thank
from the
you.
colleagues as well. But if we can discuss 1 hour, no problem. But
Yep.
after hearing this, in the left side, we have given the case instruction shortly. And our diagnosis was actually enteric fever. Any other
Take
colleague,
fever.
do you agree or disagree? Other colleague?
Yes, I was suspecting typhoid fever.
Typhoid. Any other colleague having any different other than typhoid or enteric fever? Any other colleague, please? Dr. Zaidi was thinking it was a viral disease, maybe
Uh,
extending a little more. Yeah,
depend
Dr. Abu Amar.
if he has a travel history.
No, no, no. Regarding diagnosis, is there any confusion?
Enteric
Other
fever, it's okay
enteric
with this
fever.
pulse and
Yes. 8 days fever, especially in South Asia, with generalized symptoms. There might be abdominal pain or not. Dr. Zaidi, for you especially, we have to
Yep.
think enteric fever.
Okay.
What could be the differential? Maybe with the what Dr. Abu Amar said that the with the traveling history is
Appendicitis.
important. It could be malaria, but malaria is not a continuous fever. Anyway,
Actually, the patient pulse is 60. It is relative
this is
bradycardia.
also one of the
And
indication of more likely to be enteric fever. Dr. Zaidi,
yeah,
okay? So
Mm-hmm.
I told you the
I
whenever we
understand.
can
Yeah.
make the mind map earlier, it would be better. So fever with the relative bradycardia can tell us it could be enteric fever, more common in South Asian. So you may not need even the 3 minutes time also to reach the diagnosis from the history, some time. So when it will be happened, if you are oriented with your checklist, differential diagnosis, if you interact with other colleagues or any session with, it would be better, not by single reading.
Mm.
Understand, doctor? Single reading actually is not helpful. So every colleague now look at actually the improvised checklist, or rather to say the information sheet we discussed in front of you before. And all the time when we arrange the courses, we usually modify our structure, not as it is. And it is a very new structure given to you for understanding. So who can comment about this, that each point, what is the mistake Dr. Zaidi has done? In your
I
understanding,
think
you may be wrong also, no problem.
in
Please.
my understanding, what I observed, as the patient said that he is suffering from fever, his main complaint was fever. So it is better to explore the fever in
I
detail
agree, doctor. I agree. Dr. Zaidi,
rather
did you
than
get the
headache.
point? Fever
Yes,
was not
yes, yeah.
evaluated much. Rather, Dr. Zaidi attended the headache.
Mm.
Headache is not actually presenting complaint. It is in second line, third line complaint. But very excellent, Dr. Zaidi, to ask, do you have any other problem? This is
Mm.
excellent, actually, lesson given by us before also. Accumulate all the symptoms fast. Okay, Dr. Sorry,
Because
Anushya, please, Dr. Anushya, do you like to add any
Uh,
more?
yes, actually, I couldn't listen the whole, but I think ice was missing.
Ice missing.
Yes.
Okay, okay. Dr. Zaidi, note down, please, so that it will keep your
Yes.
memory. Then Dr. Anushya.
And red flags, I think red flags was not asked. And
Actually, red
travel
flag
history.
could be after diagnosis, but
Oh,
before
yes, yes,
diagnosis,
okay.
no. Before diagnosis, also red flag could be there. But the vital signs are apparently okay
Mhm.
in
Travel
general
history,
feature.
in any case of fever, it is better to ask travel history in the beginning.
Which history, doctor?
Travel
Travel
history.
history, yes, better travel
Mm.
history. That is
Yes, I
called
missed
the
that. Yeah.
social history. That is the correction we have done. Initial diagnostic information plus social history. Sometimes social history can give the diagnostic clue also if it's a travel related disease. For this reason, this is
Mhm.
modified. So impact in life, 8 days. Why, Dr. Anushya? Any other colleague? Could you open the mic? Dr. Abu Omar, open the mic, please. Can you add?
Okay. In general, the beginning is good here now. But the differential diagnosis here not asked, like travel history, like pneumonia and UTI.
UTI already asked doctor. Might be you are not at that time.
Okay,
Yes,
that's
about the
good.
any urine problem or symptom.
Okay,
Mm.
that's good.
So for the pneumonia means you thought that he couldn't ask
And
the cough.
The cough.
and
Yeah.
also
Common cause of the infection. Okay,
Mm.
right.
that
But one red flag he asked actually, Dr. Anushya, you couldn't understand. Neck rigidity.
also
Neck rigidity could be one
should
of the
ask
red flag
about
feature.
the volume of urine and color.
Detail of the urine. But in general, could be time is not there. If you ask an open type question, do you have any problem in urine or the water walk? If surrogate said that no problem, doctor, so you switch to the next topic because you are not in real
Volume
time.
important in fever because dehydration maybe.
Yes, could be there. There might be high color urine. Surrogate today didn't tell not to make the scenario complicated. There could be common association, the high colored urine. But Dr. Zaidi is to ask common systemic symptoms. I think Dr. Abu Omar mentioned this, right?
Yeah.
Systemic symptoms.
I missed the respiratory.
Respiratory common because the
Yeah.
common site of the infection is the
Travel history.
respiratory. That is, I mentioned before, this case is non-specific diagnostic clue with, okay? Patient with non-specific diagnostic clue. This is a fever. This is one of the
All,
type of the case. Yeah, Dr. Anuja.
yeah, I was saying, in the case of fever, I think it is also better to ask about any rash.
Yes.
Yes.
Rush, yes.
Few things according to the checklist, you need to ask few questions of clinical relevance, but not all. Okay. How to
Rush.
overcome these to manage the time? At first, open question. Dr. Zaidi nicely asked the open question. I was very happy at that time. Do you have any other problem? Then come to the close question. Cough, rash, 4, 5, enough. When patient telling that no problem, no need to go inside. Because this is a clinical presentation, you need to go for the examination later. And as Dr. Zaid initially missed the clue of diagnosis, so it was a little problem for him. Understand? Dr. Zaid, you understood that our other colleague already understood this is
Yes.
enteric fever.
The
If
key
they
feature
didn't
of
talk to
this,
the patient, they just listen only, right?
yes.
That is the thing. So by day to day after practice and discussion, it will improve. It will improve. No worry.
Yes.
If any colleague want to add any more here.
If he from the beginning notice pulse, he can get the case.
Yes, that is the
I
clue we
think he is
discussed.
not focusing the pulse.
Yeah.
Actually, pulse rate given, so there is a
I
relative
was wondering
bradycardia.
why the pulse was highlighted in red, actually.
Any febrile patient. Another clue is the fever in the second week. Remember, usually viral fever should be in
Okay.
the first week. It's a
Okay.
reversible disease. Though patient would have some other symptom, body ache, fatigability, but fever will not extend more than 1 week in general. But differential, you should think dengue here. chikungunya. But fever will not exceed more than 1 week again. Malaria usually have intermittent fever. For exam purpose, commonly intermittent fever with the travel history to the hilly area. Any febrile patient, travel history must. Okay. And
Okay.
if you ask about the genital problem also, do you have any discharge? If you don't reach the diagnosis, so you must ask about the genital discharge because it's very hidden. Sometimes patient usually practically feel shy to say. But if you reach the diagnosis, enteric fever or other, only open question is enough. That do you have any other problem? Then switch to your other topic. Other topic, red flag, idea, concern, so and so. I think everybody understood it. Now come to the right side box. Drug history, already past history, family history. For example, in the febrile illness, acute febrile illness, family history is not much important. Okay. For the diagnosis, not much important. You may skip it if you will not have time. Drug allergy or any allergy doesn't give any maybe diagnostic clue here. But for the medicine or prescription of medicine, allergy is important, especially drug allergy. Vaccination, if we think that it could be enteric fever, but to be away from the enteric fever, we could ask, did you take any vaccine of the typhoid before? Just to strengthen your diagnosis. Patient would tell that, no, doctor. That means you are 99% becoming confident that it is enteric fever. So vaccination can help, especially in this febrile patient, but not for other diseases. Routine vaccination for elderly in some advanced age at comorbidities. In those situations, vaccination question should be there, minimum influenza and the pneumococcal vaccine. For the travel planning and other different vaccine planning is there. Okay. Safety netting, I think Dr. Zaidi has done well. So in my summary, some technical message for Dr. Zaidi, as Dr. Anushya said before, I am not repeating. Ibuprofen for the management purpose is still diagnosis is not clear, as you are thinking this is viral fever, NSAID better to be avoided. NSAID better to be avoided because if it is, for example, in the first week could be dengue, NSAID could be dangerous. So double dose means 1 gram paracetamol 3 times a day with some sponging and other for the fever. Plenty of liquids. What we do in general advice before diagnosis, only this management is enough. With the safety netting, you can go home if you have this thing, immediately knock me or go to the hospital. That was good. In
So,
the
doctor, I have to ask, such patient with 39 fever, I think he should be hospitalized,
not doctor, not needed
no?
always. No needed because his
Like you
vitals is
said, toxic
vital.
looking.
No, doctor, I'm telling the vitals
Okay,
is okay. Blood pressure is okay now. But
okay, okay.
regarding hospitalization, you must counsel the patient with the safety netting. Right now, patient condition, though pain is there, pain is not indication for hospitalization. Okay. Fever is not indication for hospitalization. Fever will come down if you give some proper suggestion. So why shouldn't we explore what patient was doing for the fever? Only taking the paracetamol? Dr. Anushya, why your mic is off?
Yeah, yeah, yes.
Patient taking only paracetamol, doing nothing.
Yes, antibiotic should be added.
Not antibiotic. I'm telling
Okay.
that if patient get the cold sponging, okay, that
Yes,
means
okay.
other common suggestion to get the fever less, patient is to do. So even patient can come to you and patient can go to hospital tomorrow also if condition deteriorates, but not in the
Okay.
first day today. Until vital signs are okay, think that patient be better managed in the home with a strong safety netting. It would be better.
Okay.
Better.
Uh,
If you want to give antibiotic, it will be excellent decision in different way. I don't like to discuss today. And another, actually, when we discuss the enteric fever, then we will decide. But we are discussing the structure of the practice session. For this reason, we need to switch now. If you don't have here, if child is there, elderly is there, these are separate question. If female, pill pregnancy period. So Dr. Zayadi didn't ask about the pill. Okay, as it was relevant. So up to this enough. Now, your job, my beloved colleagues, what marks you like to give here? Who actually followed whole case today? Dr. Abumar also maybe what was not from the beginning. Any other colleague? Of the consultation skill, communication consultation, basic skills, we discussed 23 principles. What marks you like to give? Poor, unsatisfactory, competent, or excellent?
Competence.
Competent. Dr. Abumar, did you follow him today? You told that you will be in the prayer.
Yes, I follow
Most
some.
anyway, whatever you
Some of
followed
them.
from there, you like to give the competent in communication skill. Then two, other colleague to give the two, to explore the two, data gathering. Other colleague, data gathering. Nobody is giving. That means in my job, I will give him competent.
Competence, yes.
Competent. I will give him competent, not excellent. The third one, other colleague, any new colleague, please, colleague, be attached with us today's session. Only it is not for listening, please. Number 3, examination or counseling. That means the plus minus counseling, whatever you say. Examination was specific. I think it should be minimum competent because abdomen examine, general examination done, dry coated tongue seen. So there could be competent. Okay. As his diagnosis was wrong, management score will be less. Okay. This is the tricky thing. Okay. So he will not get competent, maybe unsatisfactory here. And investigation plan also not good, right? Because blood culture is not there. Electrolytes should be there, right? Electrolytes, serum creatinine. Already you said the renal function. But in the exam, doctor, if you say the renal function to the patient, it is not good. Surrogate specifically asked, doctor, what test you like to do for me? It means surrogate wants to listen or hear the name of the test. Not LFT, not liver function. Okay? You have to say SGPT, SGUT, or serum bilirubin, so and so. Okay?
So in this case, since the patient asks for what test, so I can be very specific, like we'll check for your urea electrolyte and creatinine, or do we have to explain, like I'm going to check your electrolytes in your body and your renal function?
So yeah, doctor. Again, time management is very important here. Okay. If you do more practice, you will understand that you are having more time or less time. Whenever you are having the less time, you will tell only that I will check the liver, kidney, and some blood test, other blood test.
Okay.
Okay.
Yeah.
No need to explain why I am checking. No need to explain. Your behavior is good one way that you are explaining that why I will do the test. It is very expected. But your major problem, you couldn't finish in the
time.
specific time. So if you cannot finish in the
Yeah.
specific time, how can you explain? So minimum mention the name. Minimum mention the name. No need to explain. Okay. And, and similar tactics you can follow in the management also. You can tell the name of the medicine. No need to tell the dose and other, or just simple name of the medicine. Okay. And then tell that if anything happened wrong, please inform me if time is not there. Okay. Though it is expected that if you give NSAID, the tummy pain and other, you must explain. One colleague raised the hand. Please open the mic.
Yes, and doctor, I want to ask in the explanation to the patient, what should we tell? Are you suffering from typhoid fever, or we shall mention enteric fever?
Both are same, doctor. No problem. Enteric or
It's okay.
typhoid.
Okay.
Usually people understand typhoid more. Typhoid word more. Better to say typhoid. Enteric is a scientific word, right? Understood? Enteron means intestine. That is the
And more
thing.
organ. Okay. Thank you,
No,
sir.
it will not be a major issue. So, Dr. Zaidi, now your turn to ask any question to us. How did you feel? How did you enjoy this practice?
This is my first time doing this. It was hard because patient presented with just fever, and that was it. And it will be different if the patient opened up earlier with a headache and tell me earlier about the abdominal pain as well. In Brunei, we hardly see enteric fever as well. So yeah, so I think I need to read up on the common infectious diseases in
Yes,
South
common
Asia.
infectious
Mhm.
disease in South Asia. I
Yeah.
think you are living in a little bit rich country. So don't you have the enteric fever, right?
It's very rare here. Yeah, it's
Very
very
rare
rare.
here. For that,
So
I'm sorry, you
usually
couldn't
we,
identify. But don't forget
yeah,
enteric fever in the South Asian
yep,
exam.
yep, yeah. So it's an
Oh,
eye opener. Yeah.
yeah. Thank you. I think you learned today very nicely enteric fever, how it
Mhm.
presents.
Yep.
Thank you, Doctor. Thank you.
Thank
In
you.
course of time, anything you need to ask, you can ask later also. So thanking Dr. Zaidi, and now come to the next patient. Here, we will present you a patient apparently having a specific diagnostic clue. For example, goiter, right? Then immediately you can focus to the goiter. So please raise the hand who want to practice the case. Please raise the hand. Another patient.
Okay, doctor, I will try.
Dr. Anushya?
Hmm.
Okay. Okay. Let's see now. And I expect that other colleague also following the presentation will be following and comment later. Comment later. This is the patient, for example. I'm giving you example, Dr. Anushya. Don't start now. Already I told you when I tell enter, please, then I will start. This will be the exam strategy in the OSCE. They will show you the picture like this in this case. But initially, they will not give the picture. In the door place, you will see only up to this in the left side. When you enter, then they will tell, doctor, I'm having the problem in the neck and the eyes, and show a picture. Could be. That is the challenge for you, that can you identify the findings, which is obvious in front of you. Clear? So,
Yeah.
Dr. Anuja, by looking at these, I think you should have a diagnostic understanding, right?
Yes.
Fantastic. Now, what our course actually demand, that when you come to the class, that is in the coming days, we will start the class number 1. So specific cases you will rate, like today fever or that is a thyroid related problem. There might be other cases, not like this today, it is sure, separate case. But those who are advanced candidate, that you have practiced before also, many things you know, better not to see the checklist of the specific case, because you will be half blind. Okay, it is up to you. If you want to be blind and to know the case, and better blind and come to the class. This is the technical suggestion for you. So after checklist, you have gone through the goiter and other relevant disease. It is very right. Now the case is here. After getting the diagnostic clue, actually now what is my job? My job is, first of all, I have to establish that the status of the thyroid is hyperthyroidism, because this look indicates an specific diagnostic clue, and this clue usually present with hyperthyroidism. What is that? There is a Graves' disease. Establish etiology, ultimately the triad of the Graves' disease, or you can say tetrad of Graves' disease. You have to search there. Establish any complication of the hyperthyroidism. If possible, ask about comorbidity. Patient might have high blood pressure, diabetes, or other disease, asthma. And the red flag invariably. So, Dr. Anushya, do you think that the diagnostic challenge, specific diagnostic challenge, is very strong here?
Diagnostic challenge.
Primary diagnosis is rather easy here.
Yes, easy.
But
It's easy.
different areas of further diagnosis is important. Functional status, etiology, complication, identify the comorbidity, and so on. Anyway, and
Yes.
you already understood that patient having tachycardia. Could it be a great clue?
Yes.
Yes, could it be a great clue? I think all of candidate or colleagues today, all of you understood. So we can proceed now with Dr. Anushya.
Okay.
Take few seconds. I will tell enter, please. Then I will start. Enter, please.
Hello, Mrs. Sajda. Good morning.
Good morning.
I'm Dr. Anusha, your GP today. How may I help you?
Yeah, doctor, actually I am having a problem, doctor, of my neck. There is a lump, doctor, few weeks I observed.
Mm-hmm.
But few days
Okay.
before, doctor, my sister told me that I'm having some bulging of the eyes as well. So I
Mm-hmm.
become, doctor, astonished why it is happening. So, doctor, why am happening? It is happening for me, doctor.
Okay. Okay, Mrs. Sajda, I'm definitely going to help you out. Can you tell me what other problems are you suffering from?
Yeah, I'm nowadays, doctor, feeling weak, doctor, and I
Mm-hmm.
cannot do my household works as before.
Mm-hmm. What else?
Not too much else, doctor. What you like to know more?
Yeah. Do you feel racing and pacing of your heart?
Not too much, doctor. Just little.
Okay. And all these symptoms develop since how long?
Near about more than 2 months, doctor.
Okay. Mrs. Sajda, have you consulted any doctor?
No, doctor. I actually ignored it. I was thinking that weakness is very usual.
Mm-hmm.
Then I tried to
Okay. So,
take food regularly. Even I took some vitamins from the medicine shop for my weakness,
okay.
doctor.
Okay. Have you taken any other medicines?
No, doctor.
Okay. Mrs. Sajda, have you noticed weight loss over two
Yeah,
months?
doctor. Yeah, you are right. Possibly I have lost weight, doctor, in the meantime.
Mm-hmm. How much you have lost? Have you checked?
No, I don't know, doctor, but I lost weight. It is true.
Okay. Do you feel hot while others feel cold?
Maybe, doctor, I feel warmth than before. I cannot even keep the thin cloth, doctor,
Mm-hmm.
nowadays.
Okay. And do you notice tremors in your hands, shakiness?
Mm, no, doctor, sorry, I couldn't find.
Okay. And how about your mood these days?
I feel little irritated, doctor, nowadays.
I can understand. Okay. Could you please tell me what's your last menstrual period?
7 days before, doctor.
Okay. Okay. And do you have any chest pain?
No, doctor.
Any shortness of breath?
No, doctor.
Okay. And Mrs. Sarda, as you have mentioned that your sister noticed this eye bulging. So, do you feel dryness in your eyes
No, doctor.
or any pain,
No.
any gritty sensation?
No, doctor.
Okay. Any vision changes?
No vision problem, doctor.
Okay, okay, okay. Mrs. Sarda, how about your bowel habits these days?
Well, nowadays, doctor, I need to go to the washroom more than usual, doctor.
Mm-hmm. Okay, so Mrs. Sarda, do you have any past medical condition?
Otherwise, I was okay, doctor, from before.
Okay. And in your family, is there any long-standing disease?
I don't know, doctor.
Okay. Okay. What do you do for living?
I'm housewife, doctor.
And how are things at home?
I told you, doctor, nowadays I cannot do my household
Yeah.
works. I feel weak,
Yes.
doctor. Yeah,
I can understand. Must be distressful for you, but
yeah,
I'll
doctor.
surely help you out. Do you smoke, Mrs. Sarda?
No, doctor.
And alcohol?
I don't drink, doctor.
Okay, that's good. Okay, so Mrs. Sarda, what do you think? What you are suffering from?
I don't know, doctor, really, but I'm afraid
Mm-hmm.
why day by day I am going down, doctor. Is
Mm-hmm.
there any dangerous
Okay.
disease, doctor, I am suffering from?
Mm-hmm. I hope not. And what's your major concerns?
Doctor, I want to get rid of my weakness, doctor. But I'm
Okay.
afraid of the neck lump, doctor. Here, is there any no nasty disease, doctor?
Mm-hmm. I will explain you in
Please,
a while.
please.
And what's your expectation from today's consultation?
Very obviously, I told you, doctor, I want to get rid of all of my problem, doctor.
Yes, Ms. Sardash, I will definitely help you out. Uh, please calm down. Okay, Mrs. Sarda, I would like to examine you. Is it okay?
Okay, doctor. Please tell your
Okay.
sign, what you like to do.
Yeah, I will start with the general. I will sanitize my hands in the presence of chaperone and complete privacy. I would start with general physical examination. I will check the blood pressure, pulse.
Please mention the general physical examination sign, name of the sign.
Yeah, I will start with the hands. I will check any sweating on the palms
There is
and,
sweating, yes.
any redness and anemia. And I will check the tremors. And then,
There is only fine tremor by maneuver. That means keeping the paper on the hand, you identify there is a tremor. That means fine tremor there.
Mhm.
Okay.
Okay, in the eyes, I will check for lid lag and lid retraction. And
There is a lead lag and retraction both.
okay, and also I will check the anemia, pallor,
Not
and
anemic. Okay.
okay, and I will check the neck from front. First, I will inspect. I will check and also in the inspection, I will ask Mrs. Sarja, please have a glass of water.
Okay.
Just take
Yeah.
one sip,
I
and I
took
will
the
check.
one sip then, doctor.
Yes, I will go at the back, and I will from the back I will check palpate the
Anyway,
neck.
the lump is moving up and down during
Mm,
drinking of the water. Okay, understood.
okay, and I will also check any lymph nodes and lumps
No
and
lymph
bumps in the
node.
hand.
Yeah, no lymph node.
Okay, okay. So Mrs. Sajda, I will sanitize my hands again, and Mrs. Sajda, please come back
Okay, thank
and
you, doctor.
thank you for letting me examine you. You were quite cooperative. And Mrs. Sajda, I would like to offer few tests. Is it fine?
Yeah, doctor, please.
Okay, I will do TSH, T4, PT4, PT3, and thyroid TRAB antibodies. And
Okay,
I will also do the ultrasound neck
okay,
and ECG.
okay.
Okay, so Mrs. Sajda, according to your history and examination, I suspect you are suffering from a condition called as hyperthyroidism. Have you ever heard about it?
No, doctor.
Okay, actually, Mrs. Sajda, as you can see in the neck, we have one gland over here, which is we call as energy gland. It is
Okay,
responsible for many functions of the body, but
right.
when it becomes overactive, so the hormone it produces becomes excess in your body. Are you
Okay.
getting me?
Yeah, doctor.
So
2 minutes left.
uh,
2 minutes left.
Okay, because of the excess hormone, it gives such symptom that you are feeling weak, you are losing weight, your racing and pacing of heart is there, and
Okay,
you are going to the washroom more than often. So
okay,
these are the symptoms due to the excess of this hormone in your body. But
okay.
the thing is, we have treatment for this, and with proper treatment and regular monitoring, you will be completely fine. Are you
Fantastic, doctor. I
understanding me?
expect so, doctor. I expect
Yeah.
so.
So I am there to help you out, and I will, as your pulse, which should be normally less than 100. So Miss Saida, it's 110, and you are having all the symptoms of this disease. So I would like to start you on one medication.
Okay.
So may I know, do you have any allergies?
Allergy means itching,
Uh,
doctor?
yes, are
No
you
itching,
allergic to any
doctor. Any
any
medicine?
medicine?
No, doctor, not known.
Okay. And do you ever had asthma attack?
No, doctor.
Okay, that's fine. So I would like to start you on a medicine called as propranolol. I will
Okay,
start with
okay,
the
okay,
10 mg twice a day
okay,
because this hyperthyroidism, I would like to give you a referral to us to the gland doctor, to the
okay,
specialist. He
okay.
will start you on a medicine called as carbimazole, and this medicine only he can start you, okay? And he will do close monitoring, and he will check you every week with CBC because sometimes this medicines makes the blood count, blood levels, it will make it very low. So we will keep a check. For example, anytime you have infection, sore throat, any infection, you
Time
have
up,
to come to
time
the.
up. 1 minute
Okay.
more, doctor. 1 minute more,
Okay, so
complete.
okay, I will. So, Mrs. Sarida, I would like to say, as I have told you about the medicine propranolol, it will surely give you symptom relief. And for the eyes, I would like to give you some lubricant drops because your eyes are getting dry these days. And when you sleep, please cover your eye with the I would provide you the leaflet. You have to cover your eyes before sleeping
Okay,
because if your eyes are completely exposed to the air, then it will become more dry and you will have sometimes you may have eye infection. So I have to take care of this as well.
okay,
Are you with me so far?
okay, doctor, okay.
Okay. Okay, so Mrs. Arja, any questions?
Should I go to the gland doctor right now, doctor?
I am making a referral. You
Today,
will
doctor,
get.
today?
You will, within 2 weeks' time, you will get the
Thank you, doctor.
appointment.
Time up, time
Okay.
up.
And then if you develop severe racing and pacing of your heart or too much feeling heat, then come to me immediately.
Okay, thank you.
Thanks.
Thank you,
Thanks for
no more, Dr.
coming.
Anushya.
Thanks for coming.
Thank you, Dr. Anushya. Do you like to hear the comments from colleagues?
Yeah, yeah, sure.
Very right. So before comments, actually it is a very big chapter, thyroid, right? So if you go through the source, any book or reference in the internet, in the examination part, you see a lot of things. If you do each and everything, it will take 15-minute time. So
Yes.
practically, we will not check. Our idea actually just in the slide, in the right side again shown to you in the right bottom that I have shown you before. The diagnosis, comorbidity or complication like this and the status of the
Okay.
gland. For this reason, many other thing we reduced from the previous slide. From here, this is a less list. Though these are actually seeming to be a bigger one, but actually not like that. Within 2 minutes, 3 minutes, you could do it. But what is the area of focus for the examination? This is a thyroid gland itself. Other findings are from the general examination. We could have some cardiovascular findings also. Okay. So it is a multisystemic disease. Usually endocrine is a multisystemic disease. For example, diabetes. But here thyroid as a gland is there, goiter is there. Our focused systemic examination will be in the neck. Inspection, palpation, percussion, sometimes percussion not needed. Rather, auscultation was important, what Dr. Anushya missed.
Yeah, I missed.
In other area, only one or two. For example, for atrial fibrillation, if you could see the pulse rhythm, it could be enough. You forgot to see the rhythm. Okay.
Okay.
It can tell you a patient having the red flag, one important red flag or the atrial fibrillation. And in the history, very nicely asked about that. Do you have the vision problem? Though you could not see the vision in examination, finger count or other, but you finish in the history, I think it will be sufficient. Okay. But better
Okay.
not to do double check. Double check means the tremor you asked before, tremor is not there. Then you have checked the examination in the hand. Understand? So
Mm-hmm.
technique will be that as you will examine the hand, because you are allowed to examine and you are instructed to examine, why you are asking tremor in the history. It is a very technical suggestion. Understood?
Mm-hmm.
No need
Okay.
to ask there. But
Okay. Okay. No,
for example,
fine.
anemia must be seen in the conjunctiva. We cannot ask about anemia from the patient. But we can ask about the tremor. It doesn't mean that I will ask. In our checklist, possibly you are not using our checklist, other colleagues are using. You will find in the history part, there is a tremor or shaking of the hand. But to make it practical, in the practice session is important to describe that you will not do the both things because you are getting same information. In this way, you have to manage your time. I think in short, I tried my best to explain the technical point. Anyway, so our diagnosis will be Graves' disease with hyperthyroidism. But one colleague, incidentally, I have seen Dr. Javed possibly said, Dr. Anushya, why it is Graves' disease?
Because of eye signs,
What signs?
you said in the examination, lid retraction,
There is a
lid
proptosis is there one.
proptosis, yes.
Lid
Exophthalmos,
retraction, though it is a features of hyperthyroidism, but it is found associated with the proptosis. So there is, anyway, indirectly we can say proptosis. And then, Dr. Javed, please, can you open the mic to share with us? Possibly you have commented. You listen, Dr. Anushya, anymore? Dr. Javed, please, can add.
Yes, yes, sir. Because for Graves' disease, hyperthyroidism can be together. Because Graves' disease has features of hyperthyroidism, which Dr. Nusha already asked. And plus, she's rightly said about the eye signs, proptosis, and lid lag. Plus, I think pre-tibial myxedema, I think examination she missed. Plus, I think cardiac examination for atrial fibrillation or fast heart rate.
May I add something? Actually, atrial fibrillation is a complication of the hyperthyroid state. It
Yes,
is
sir.
not directly relevant with the Graves' disease. Graves' disease is a basic disease, usually told as the triad: proptosis, diffuse enlarged goiter, and the pretibial myxedema, with thyroid acropathy or clubbing, rather to say. Okay, these four features. Graves doesn't mean hyperthyroidism, though most of the time there is hyperthyroidism. Graves could be euthyroid also. Graves could be hypothyroid also. So it is not invariably that Graves means hyperthyroidism. These are two separate things. But the features of hyperthyroidism, what Dr. Javed correctly mentioned, that Dr. Anushya couldn't look at the leg today. That is a lacking. It is a part of evaluation of the Graves' disease. But commonly in our practice, we find the exophthalmos with diffuse enlarged goiter. Clear now? So up to these, we can prove it is a Graves' disease in general, but for the exam purpose, and you can see in the literature, books everywhere, pre-tibial myxedema as it is included, plus clubbing of the finger, better to be seen. Because only four things are there for the Graves' disease. Other things are the features of the hyperthyroidism. Though there is some eye features, compression of the eyeball, as well as compression of the optic nerve, as well as compression of the muscles moving the eyes. It could be features of Graves, no doubt. Anushya, did you get the point? What we discussed?
Yes, doctor.
Is a Graves. Hyperthyroidism means tachycardia, sweating, tremor, and others. Okay. And very interestingly, many features of the hyperthyroidisms are there. Everything better, practically no need to be seen. What you will do? For example, atrial fibrillation is there. You will manage the patient accordingly. But patient might have exaggerated jerk. There could have some weakness in the muscle, proximal myopathy or other, whatever you say. What will you do? By looking at the exaggerated jerks there? Nothing. Before looking there, you already able to diagnose the Graves' disease, already able to diagnose the hyperthyroidism, right? For the management purpose, other features, though it will be accompanied, we should have in our mind, but we will not do. Even we will not ask also. We are asking in general, do you have any other problem, any other problem? If we have minimum 2-3 features, it is diagnostic, especially warm intolerance. It is very important. Okay, appetite. It's the interesting thing possibly Dr. Anushya missed. Weight loss is there, but appetite is good.
Okay.
Intentional. It is a very good. And on examination vision, okay, no problem. Is methodically when I advise for the investigation before I need to tell my probable diagnosis. You didn't do it. You told the probable diagnosis after
No,
planning
I did.
investigation.
No, I did TSH. I advised the patient TSH, T3,
Yeah, that is
T4,
the thing, doctor. Sorry to say.
antibodies and ultrasound.
Before
I should not
TSH
have
and
done.
other, better to say your probable clinical diagnosis earlier.
Okay. Okay.
Because you need to explain why you are doing this.
Okay.
Investigation is a
Okay.
part of the management. Remember, investigation is a part of the management. After telling the diagnosis, then do some fever paracetamol or here the beta blocker, and then doing some investigation, right? You don't need to do investigation to give the beta blocker. Only asking history or clinical examination enough. This is our tradition for learning, okay? Then investigation and wait for investigation. Before getting the report, you are referring the patient to the gland clinic. What was actually
Okay.
is it was to be. Referral is a good idea here, but you will tell that after getting the report, I will decide should I refer or not. Should I send or not? Okay. And
Yes.
for all of you, remember the latest update. The South Asian OSCE is not actually the MRCGP UK OSCE. So you are reading the book, many other sources, there's some difference. And you should be acquainted with this difference that we discussed in the last day. I don't know, Dr. Anushya was there on that day. The latest development is the OSCE, after the OSCE, South Asian examiners are making you a specialist. See, is it very hard to treat the patient for hyperthyroidism, Dr. Anushya? No, because you
No.
know what you are explaining, you know it.
Yes.
It is not the operation, the appendicectomy, you don't know. But you can
Yes.
give the carbimazole, can follow the patient with CBC. Okay, even you know that the antibody test could be done here if needed. Antibody for management not needed, doctor. Don't include antibody.
Okay.
The ECG if you suspect atrial fibrillation. Otherwise, only thyroid function test is enough. Nothing else for
Okay.
the management.
So, doctor, it means I should have said like this after the examination, I should be telling the patient that according to what I have found in examination and history.
Not only examination, very simply, after
Yes.
my assessment, manage your
Okay. After
time.
my set.
After my assessment, uh,
Okay.
before that you can summarize a little. You have this thing. I found this. After my assessment, I am thinking possibly you are suffering from hyperactive gland in the neck, which we tell hyperthyroidism with the Graves' disease.
Okay.
Have you heard about it? Finish. It will be very realistic. Okay. Better
Okay.
don't go for more explanation. I appreciate you that your performance is, I think other colleague also will agree that it's better, no doubt. But still there are some technical flaws are there. Okay. To make your performance excellent, I hope you will overcome in course of time
Inshallah.
by doing more
Mm.
practice. Without practice, it is impossible. It is impossible. I think now I can switch the mic to other colleague, please. From here, okay. Sorry, I took more time. From this list or the, what I say, our observation points, could you please anything to add? Any colleague, open the mic and comment, please, if we missed anything in our discussion. Already Dr. Javed commented a little. Another colleague? No more. If no more, what else with me now? Already I have told everything, doctor. More overactive gland. Okay. That's all. Other thing. Referral could be there. Okay. Referral could be there. And alcohol and other you asked about, doctor, before
Yes, doctor, I
examination. Before,
asked.
no.
I,
Before examination, you asked about the alcohol, the lifestyle, maybe
yes.
for other thing. But in this case, it is okay because you got the primary diagnosis here, okay? And you are very
Okay.
competent that you could finish the examination very swiftly. For this reason, for you, it is okay. But like the previous case of the fever, Dr. Saini, our honorable colleague, he was searching for the diagnosis, is that it? So no need to ask about their all other many other, especially cigarette smoking, alcohol, these are not related. First reach to the diagnosis. Initially in the history can help, but if history cannot help, go with the clinical examination with some clue, minimum clue. So better to reach the diagnosis. Then quickly ask other alcohol, cigarette and other thing. Okay. What about diet, leisure? Many other things could be asked.
Specifically, yes, doctor. In this case, because if she would have come as a smoker, I would advise, because smoking reduces this
That
eye
is
signs,
okay. That is, it is found.
eye disease, eye,
But we will not advise for
eye
smoking or
disease.
other, right?
Okay,
It is okay. This is
okay,
okay. It is okay if you can correlate. But again, my suggestion, look at your time remaining.
yes, yes,
And
yeah.
I observed that you are alert about this, no doubt. But lastly, 1 minute given extra so that you can finish it. And asking the question is very good. Do you like to ask anything more? This is our learning to all the colleagues. Keep 30-second time in the last 10th minute. Whatever you ask, major things you finished, minor thing better not to ask in the last 30 seconds. Minor thing better not to ask. What will you do? Let the patient say, do you like to ask anything more? Do you like to add anything more? It will rather more important than saying minor things for exam purpose. Okay. So in the performance, please colleague, give the mark one by one. Open the mic. Any colleague first? The consultation skill. Dr. Anusha will be happy. Dr. Zaidi, right?
I think it was an excellent one because
Excellent. Okay.
she,
Okay,
yes,
thank you. I like to ask other colleague to give the mark for the second one, data gathering.
Competent from my side.
Competent from my side. Dr. Abu
Yes,
Omar.
consultation is excellent, yes. But
Oh,
data,
Dr. Abu Omar. Abu Omar means Abu Wahid.
Excellent.
What? Third one.
Excellent. For
Excellent.
data gathering and examination.
Examination, counseling. Okay, also. Okay, then management investigation. Please, other colleague, why not responding? Management.
competent.
Competent. Yes, competent. Very right. Very right. So if you can assess the candidate, your performance also will be better. So our course actually accommodate all of the things, not only performance. Dr. Zaidi, do you understand?
Yes.
And it is very easy to comment other performance. But when I will be performer, then it will be hard for me, right? Comment passing or commenting is rather easier. So I prefer it. Colleague should comment. Okay. Colleague should comment. Then if you can comment, it means that you are mature enough. For this reason, in our course also, in coming day, what we will do after performance, we will invite you to comment, but not detailed. It will be shorter. Today, as an introductory class, we are taking more time. As you know that within 2 hours, we have to finish 5 cases. Dr. Anushya, anything from you?
Thank you so much, because I understood my mistake.
That's good. That's good. So I myself agree with the markings given by the colleagues. Okay for you? So very nice to see you today. Okay, I don't have any further thing. Definitely practice will make perfect. Thank you very much for those who participated. So after the 2 cases, we like to tell you this is the blueprint of the Royal College. Most of you know about, and we have designing this thing, but a little in advanced way, not as it is to make easier performance. That chronic case, acute case, psychosocial, preventive lifestyle separate here, but we select a specific day for investigation report related stations to make you competent about ECG, X-ray, and other reports. That means the lab reports. Another one, pediatric, geriatric, sometimes proxy cases. Patient is not here. They didn't mention about it in the blueprint. So we separated one day, separate day for this proxy case. And the miscellaneous issue, from the miscellaneous issue, we selected one day for the breaking bad news. It is a very excellent performance will be there, though it is not very common, but not uncommon also. But it is an excellent, exceptional skill. And other thing together, we make another miscellaneous. So 8th day over. After 8th class, we mix the case 9 and 10. And we hope that it will be blind case for you. And we advise you also that it will be blind case without any clue. Okay. So as you will read the checklist, it is up to you now, doctor. Okay. We will give you as a blind case in general in the class. For example, if Anushia's performance, we consider Dr. Anushia's should do blind case. What do you think, Dr. Anushia? I don't know. I am thinking. Okay. Dr. Anushia's should do blind case better. But those who are thinking that, no, I have to look at the checklist earlier, you can see. It is already given in the Google Drive. So that is from our side, doctor. Our invitation for you in the group, if any new colleague.
Doctor, I have one more question.
Why not, doctor, please?
Yeah, I want to ask, for example, if I have done any unnecessary investigation, like in this case ECG, so what this will impact on my
They will
performance?
write the negative thing you have done. It will underscore you. Look at here.
Underscore,
Look at here.
okay.
Look at here.
Yes.
This is a negative box is there, right? Under the management headline. The examiner will write that ECG done unnecessarily.
So it will deduct marks.
But again, if you don't do ECG, if patient having arrhythmia, then they will write ECG not done. Okay, it is a negative score. Both are true. Both are
So
true.
unnecessary doing labs will deduct the marks.
Definitely deduct that. Deduct means they will make a balance. They will make a net outcome by plus and minus here.
Okay.
Plus and minus here. Then they will make excellent, competent, and other thing. Okay. I think all of you understood.
Thank you, doctor.
Okay. So any other colleague, you can immediately join if you're new colleague. And this is actually I already described for you. We hope our next class will be in the next Sunday. Those who already enrolled for your kind information. Yeah.
Dr. Osman, I just have a quick question. Can we just go back to the marking sheet?
Or to see again? No problem. No problem.
Yeah. I think I saw somewhere that there's an overall marking at the bottom.
Overall number 5 overall. Number 5 overall. For example, for you, in the overall, the mistake happened to you is the time management. You couldn't finish everything. Okay. So in the overall mark, you will get unsatisfactory. Not only for only one thing, there could be other thing also. Okay. And for Dr. Anushia, in the overall, she might get competent. But this is overall, it's very non-specific. Okay. But examiner is to write something. Why examiner giving unsatisfactory? Why examiner giving the excellent? There may be the negative, nothing more, but all are the positive things what is done by candidate. This is the overall mark. I didn't show because my slide will be smaller for that. Font will be smaller.
Okay.
But categorically, the what I say, mathematically, we can give the mark in this way for your performance. For this reason, I reduced. The 1/5 is there definitely. It was in my first slide. Okay.
Okay.
Thank you very much. Thank you very much.
And then, how do we know if we pass that
it
station?
Is separate thing, doctor. We discussed in other session, other way. Better not to discuss today. Okay.
I see. Okay.
What's the time?
Okay.
As you applied for the exam, now do or die and fight. Don't think about this. Why they will make you pass another. You need to prepare yourself by practice. Okay.
Okay. Understood.
Single alone, not alone, with the friends or the mentor like ours. We will try our best for you. Otherwise, you talk to your friends and others. Do or die. Okay. Don't be analytic more and more. Don't waste time. Okay. That is the thing. That is the thing. So any other query from our colleague? No more? Okay. And this is very beginners. Even those who are preparing the exam, if you want to be aware or oriented with the basic thing, you can look this module. It's very popular now. And already we have added the checklist, more checklist. In our previous, I described this is the 50 case practice only. It is mainly practice, not reading the checklist. But in this module, there will be more than 100 checklists, near about 150 already, near about 100 added. Within few days, we will add more. So near about 150 checklists could be there within few days later. And there is some, or what I say, discount like that, especially for the examiner, really, for 2 months coming exam. So up to these enough, doctor. If you want, you can communicate with us. And thank you very much to be with us. If you no more comment or other thing, we like to conclude now. Thank you very much.
Thank you, sir.
Thank you, Dr.
Welcome, doctor.